Your healthcare is a decision between you and your doctor, not a contract between a hospital and an insurance company.
Hi, I'm Dr. Erik Vilen,
And I'm Dr. Janna Vilen.
and today we're going to be talking about healthcare insurance and why we're different and why we don't take insurance at Intuition Health.
Yeah, so one example of this is if you had knee pain, and so you go into your doctor, and a lot of times when you first go with knee pain, they're going to tell you to take some anti-inflammatories, ibuprofen, Advil, leave. Maybe they give you a different prescription medication. Maybe they send you to physical therapy if you're lucky. Otherwise, a lot of times if that doesn't work, then you get a steroid injection. And what they don't tell you is some of the negative effects of steroid injections. So you'll hear this saying where they'll say, well, the first time it works really well, and each time you do it, it works less and less. And eventually it stops working. And if you step back a little bit and think about that just conceptually, it doesn't make a whole lot of sense why you would do something that over time works less effective. And then what happens? Eventually, your knee deteriorates. It actually deteriorates faster the more anti-inflammatories you take. The more steroids you get, and the doses that we're currently giving are way over what our body's ever made. And it actually progresses your arthritis. And progressing the arthritis also increases the pain that you have from that arthritis. And so now you're sitting there, you're uncomfortable, you can't sleep, you can't hike, you can't hunt, you can't do all these things that you want to do. When you go back in, they tell you, well, it's not quite bad enough for surgery. Or you say, well, it is bad enough, and maybe on x-ray or whatever, you're meeting requirements or not. And so they're saying, well, now you have surgery. And so those are what's covered by your insurance. And so that gap between a steroid and anti-inflammatories and surgery, there is a very big gap in that. And so that's one of the things we want to cover at Intuition Health is we want to offer those services that cover that gap.
Yeah. And one thing that we see a lot is patients come in and they say, I've been doing this, right? And I've been doing it for 5 years and it quit working 4.5 years ago. And our question usually is why did you do that, right? It wasn't working. And their answer is usually, well, that's what my doctor told me to do, and that's what my insurance covers. And so whether it's arthritis, back pain, pre-diabetes, diabetes, lots of people keep doing things because their doctors keep telling them to do it because that's what's covered by their insurance. And as Americans, that's clearly not working, right? We're getting unhealthier and unhealthier. Our cost of insurance-based care keeps going up and up and up, and people are having worse and worse outcomes. Yeah. So today we're going to be talking about some of the things that really should be happening and why you should consider not going to an insurance-based provider.
Yeah, and I think one thing to remember with that is when we say covered, people assume somehow in their heads that if something's covered, they're not paying for it, but you are paying for it. You have a premium every month that you're paying, and that's not cheap.
Your employer's paying part of that.
Your employer's paying part of it, right? And then your deductible. So, you have to have insurance. We understand that. And so, a lot of people now have these high deductible plans. They have HSA, FSA, which is actually nice because it does give you a little bit more freedom in your choice, but people don't want to use those accounts because they feel like, well, that's my money. So they don't want to use that, but they're going to go with somewhere where, it's covered, and you are still paying for it. What will happen is the more you use your insurance, each year they take that and they say, well, look at all these costs that you guys use. We're going to raise your premium next year. We're going to raise your deductible next year. So the more we use our insurance, the more they charge us for our insurance in the first place, but also the more they charge us for those services, because it is really a contract between the insurance companies and hospitals. And so that's who makes these prices, and that's why it's so variable wherever you go, and you have no clue what your bill is going to be. You have no clue what your payment's going to be. And so what we're trying to do here is say, okay, there is this gap of things that could make you feel better and get back to doing the things that you like to do, but you will know the price. Like, you will know the price before you have it done, and you get to make that decision as a consumer if you feel that is worthwhile for you.
And we really think it's very important that physicians and patients have the opportunity to talk about all the options, right? You get to decide what it is that you want in your healthcare when you have the knowledge to actually make the decisions, right? Lots of insurance-based cares have little to no medical evidence for them, but you don't get any other options from your doctors because they don't A, know about it, and B, they're scared to tell you about it because it's not covered by insurance. So our goal is to really provide you with all the information as a consumer and as a patient who has autonomy to make those decisions about what you want your healthcare to be, and the transparency to know what the risks, what the benefits, and what the costs are And then that decision is up to you. And for us here at Intuition Health, then to be able to provide some of those services to you, if that's the decision that you make, instead of pushing you towards a surgery that you don't need because the hospital's bottom line depends on doing things that aren't most of the time medically necessary and have little medical evidence for, but they make the hospital system money.
I mean, a great example, we were talking about knee pain. So
Yeah.
a knee replacement is actually 50-50 for whether or not your pain's going to get better. So, that's not very good numbers, so 50-50 of having less pain and improved function, right? And a lot of times once you're past that 90 days, like your surgeon doesn't want to see you anymore. And so if you're not doing well, you're like, well, where do I go? And even if we can't do everything for you, we want to be able to guide you maybe to these different services. And part of that is this shared decision making. We've changed how we go through visits with patients. And I think shared decision making is something that needs to be talked about because it's actually between the patient and the physician. You need to know all your options, and it's hard to know all the options, and sometimes we're still learning and what those options are, and someone will bring something in. So I think it goes twofold. The physician needs the training, and most of what we learned has not been from medical school, it's not been from residency, or even very little in fellowship. And so when you try and change your mind and go against the grain, it's hard, but you have to have an open mind. And so that needs to be part of it is, okay, I need to know what these options are to give to my patient. But on the patient side, you also need to be a little respectful to your physician. And so I think sometimes those visits are so short. The average is 7 minutes.
Right.
It's everyone feels empty. The doctor's upset if you bring in, this, a lot of times it's a Google search, not a study, and they're feeling like disrespected. And so I think it's trying to, how do we change that conversation too? But part of that has to be time. Yeah. And so one of the reasons we went out on our own and don't take insurance is I don't want to get dinged because I spent, 30 minutes with someone or 60 minutes with someone, and so I'm running behind or I'm not making whatever they think I need to be. And 7 minutes is not anywhere near enough time.
It's not, and it's not. And the biggest complaint that patients always have are two of them. My doctor didn't spend enough time with me, and they didn't examine me. Right? I used to be the head of a primary care department for a large healthcare system. And so I talked to a lot of patients who had complaints, and I would read a lot of notes, and the number of primary care visits and also specialty visits, right, when I'm reviewing charts where the person didn't get examined is astronomical. And so if you are a patient and you want to be able to talk with your doctor, you want to be able to tell them what's important to you, you want the doctor to spend the time examining you and having that discussion about what's important to you, you need to have a place where you can have that time. So all of our initial consults are a minimum of 60 minutes. And if you want more time, we're more than happy to take the time. Right? If you want all your appointments to be an hour, right, we can do that because our goal is to be a partner with you and come to a decision that you make knowing that it's an informed decision with all your treatment options.
And believe me, we're empathetic to physicians. We both did traditional primary care for a very long time. We've worked in different systems and it is difficult. I mean, they like your primary care physician, like your PCP is like, they have a special place in our heart. Like it is one of the roughest jobs. You have to be extremely smart. You have to know, it's not a little bit about a lot. You need to know a lot about a lot. And you're given a very short time. You're the gatekeeper to all these other referrals.
Not only are you the gatekeeper, you're the dumpster. Because when your surgery, right, you have pain after your surgery and it's past that 90 days or that 180 days, you know what your surgeon says? Well, your knee replacement looks good. Go back and see your primary care doctor for managing your pain.
Yeah, which
right?
the
Or your
primary
back
care already know
surgery.
what to do for you. So so being, I mean, definitely understanding the place your PCP is in, that like what that, the time restraints and the stress they're under, we didn't want that anymore. And we don't want that for our patients. We want a place for our patients to go where, we're not doing traditional primary care in this sense anymore, but we're definitely doing something different, and we wanted to have that time with our patients to understand that. But being understanding of your PCP, and like you can't bring a list of 25 things into your annual visit. Now here you could, like, right, like, I mean, like,
and we'd be happy to take the time.
Yeah, but that's you have to look for that, right? You can't just assume at the end of your annual visit, where there's having to get through these check boxes that you can do that. So part of this is also, as a patient, as a consumer, trying to search through someone who meets what you want. And if you just have a couple straightforward things, we can also do that. And I think that goes kind of the next area, which is, what is preventative health? When you go in and have your annual physical, it's meeting some check boxes, it's meeting some criteria, and our current preventative health is actually early detection. And we're not saying you shouldn't do it. Like, that's not, you should know all your preventative screening options, your early detection screening. But true preventative health is actually stopping something before it happens. And so something like diabetes, you got to go back stages, before that happens.
And I think that's a great example, diabetes, right? Yeah. So there is essentially nobody in a traditional primary care setting that will look at someone's fasting insulin level and start assessing when they're developing insulin resistance, which happens, the studies show, at least a decade before you develop diabetes. Diabetes type 2 is a truly preventative disease, but by the time your A1C is abnormal, right, we are in the early detection of disease. We are not in the prevention standpoint. And that is a perfect example of thousands and thousands of people every day going to their doctor and not getting an assessment, which is truly prevention of a disease a decade before it starts, that we know how to treat it, we know how to intervene, so you don't develop that.
Yeah, so what they're waiting for is these early detection are actually trying to wait till you have a disease, so a chronic disease, that then we can manage with medications or surgeries or procedures. And so both from a pain perspective, we want to wait, we want to treat you long before you go have surgery or have steroid injections. If you have diabetes, we can still help you, reverse those numbers, but we want to try and decrease your medications, get you off medications. But ultimately, we want to catch people when they're children, teens, 20s, 30s, 40s, families, to try and actually prevent that from happening versus waiting till you're extremely sick. So there is a pretty big difference between true prevention and what we call a preventative health visit. Right. It shouldn't really be called that. It really should be called an early detection screen.
But I think that's a good point, and how we define health really matters. So when you go to your doctor and you have 3 chronic diseases and are on 6 medications, but all your numbers look good, you're well managed, they'll be like, great, everything looks good. Well, you're on 6 medications for 3 or 4 chronic diseases, which is the average in the United States. That is not health. That is management of an illness, but that is not health. And we really want to focus on redefining what it means to be healthy, right? And that is where the true prevention comes in, rather than, you're well managing your chronic diseases, which, even being well managed, lead to death and disability and not being able to do the things you want in life.
Yeah, and so some of the things that when we talk about that we're looking at is, sleep doesn't get talked about a lot. So that's a big one for us, is like, okay, when we're talking about, first actually want to know what matters to you. I think that's a big piece, is like a lot of the conversations we're asking is like, I don't want to know what your x-ray said, I don't want to know what your MRI showed. I will look at that as a tool I use, but I want to know, like, well, what brings you in? Now that you have a meniscus tear, I want to know, like, what can't you do? What matters to you? Like, what's your purpose? And then from there we start to look at these different factors, because if we go back to our knee pain, if you're not sleeping well, really hard to heal and repair. You're not going to feel very good. You're going to stop doing things in the community, social things that you used to be able to do.
You're going to be cranky with your family.
Cranky with your family. You're going to be upset that you can't. You might not exercise as much because it hurts to exercise. And we know when you don't sleep, you make poor food choices. We know when you're in pain, you make poor food choices. And we're already in an environment that just pushes that. So, stress management, when you are cranky, how do you deal with those feelings when you feel bad that you snapped at your family? So
you eat bad food.
Yeah, you eat bad food. And so, we're trying to look at these things, and some of the other tests that we had talked about that aren't just, one of the best predictors of overall mortality is something called a VO2 max test. And we do that here. And so no one else, does this, especially in the traditional medical center, but it's something.
Because it's not covered by insurance.
It's not covered by insurance, but it's actually a great test, and it's something objective. And something like a DEXA scan that everyone knows for bone density. It's a simple software change to look at what percent muscle mass you have, what percent fat mass you have. So if you've done this yo-yo dieting over the years, you actually know the effects it had on your body, because they can be quite dramatic. And again, it's not covered. It's not covered by insurance to get bone density, but they won't cover it to get the muscle
and
fat loss.
with that, we can look at what's the amount of fat around your internal organs. That's another, finding that is critical. If you have excess fat around your internal organs, you are at
And he means like your stomach, your pancreas,
your
like the
liver,
things that are like what's called your viscera, yeah.
But if you have excess fat around those organs, your risk of every chronic disease goes up significantly.
And that's different than like extra fat on like your thighs and your butt. That's they're very different.
Very different.
Things.
But
the
again,
doctor has to know, one, to get the test, which again we're not taught. No one talks about it, and they need to know what to do with the results, because telling someone to eat less and move more doesn't make those numbers.
Well, that's
better.
really like
So,
eat less, move more has put us in this position. That and my plate.
Yeah, the food pyramid first and my plate. And I think that goes to when we talk about healthy, is our view of healthy has been very skewed over the years. It's gotten, significantly changed, where it's almost like the seatbelt, where it was like, oh, everyone, we used to wear, or we never wore seatbelts, and now we do. And so that's just the way things are, and it's better. It's like, but that's not how weight works. That's not how fat accumulation. That's not how chronic disease works.
Right.
We're not in this. We shouldn't be in this stage where just because that maybe we shouldn't have been that size back then, and we should all be okay in our bodies now. There's a difference of loving yourself and
being healthy.
And so they should go hand in hand. You should love yourself to make these changes, but we shouldn't just say, well, you're you're morbidly obese, but it's okay if you love yourself. And no one wants to hear that, and you can get yourself in a lot of trouble in a sense. But it's a really, I think, an honest conversation that we were normal. If you look at pictures from the 80s and 90s, our size was considered extremely normal. We're no longer considered normal. People look at us and think that somehow we're genetically gifted, or that we're the lucky ones, and that it's unattainable to be fit like we are in our 40s.
I am technically overweight with a BMI of 26.
Which is why we don't use BMI when we use the DEXA scan. It's an interesting concept of how we've skewed what we've become accustomed to, and we are like, oh, this is all acceptable. And I don't think we as humans should allow this to be acceptable, to be unhealthy, have a bunch of chronic diseases managed by a bunch of medications, decades younger than it used to be, and coming back to just because, okay, if these people, if we're fit and we're healthy and we're doing well, maybe what we have to say and what we're doing is working, versus saying, well, that's just not for me. Because we do believe it's attainable for everyone. Right. We just need different information and different guidance. And we need a different system to put those changes into.
Right. I think that's an important point, right? Health is attainable for everybody. The medical system that you and I have traditionally operated in is not a system of health. It is a system of managing acute and chronic disease, and that's it. It has no interest in making you healthy. Hospitals do not make money. Insurance companies do not make money by having healthy people.
And our acute care is good. I think we can step back and say our acute care in America, is pretty darn good. Right. But what people don't understand is that's we have the best healthcare system. Well, let's you can get away from politics by just saying our acute care is good, but our chronic disease prevention is really bad. We might do well with chronic disease management and keeping people alive longer, but are we keeping them alive well longer? And that's really what we want to look at, is you want to live longer and you want to live better during those years. And that's where it's what's your purpose? What's your mission? What does healthy mean to you? And how do we get you there and have this system to help you get where you need to be? Right. And troubleshoot, it's a journey you take. If you troubleshoot along the way. It's not this is what I'm going to do for 6 months. It's it's a 6-week program. It has to become something you do for the rest of your life, and that's going to ebb and flow as time changes.
And that's really one of our focuses, is what changes can you make that are sustainable, right? We're not a fan of 21-day challenges, 6-week programs, because that is not something that you can do. Right, long term. If you could, it wouldn't be a 21-day challenge or a 6-week program. So we want to take a long view of health and where you want to be in 2 years, 3 years, 30 years, and associating what's important to you, your mission, aspiration, purpose, is how you integrate that into your life and keep it going.
Mm-hmm. And I think, it's we're not saying this is going to be easy. We can also say it's going to be hard work, but it'll be worth it. And so I think most people, this is where I came from the name intuition health, is your intuition usually is telling you that what you've been doing isn't working. Like the example of someone who's been doing something for 4.5 years, it's not working. They know it deep down, but they don't know what else to do, right? Because they don't know another system. And so, instead of being complacent in this system, we're trying to give consumers, patients, Americans, humans, another option that's outside of the traditional healthcare system to see if it's right for you, to see if it's something that you want, because that is how things change, is if we all start seeking out something different and we start paying for things that matter to us, and we put our money where we think it is, instead of just relying on an insurance company and healthcare system to tell us what's best for us.
And I think that's an important point, right? Is that you want to have a physician that is not beholden to any one thing. You are an individual, and so you may come to us and we may say, okay, like with you and the information we have, we make a shared decision, and it doesn't work, right? For whatever reason, like becoming a vegetarian didn't work for you, or whatever it is. You want to have a physician that is willing to change with you and work with you, instead of saying, you know what, I don't know what else to do because that didn't work.
Or it must be your fault because you didn't
Right,
know what I told you.
Yeah, right? I mean, you want to have a physician and a team that works with you, because things are going to change over life, right? And so I think that's one of the things when you go to most healthcare systems, it's like, well, here's what we do, and here's our protocol, and here's what you have to eat, and if you don't eat the Mediterranean diet, like we're not going to work with you. So that is not how we operate. You're an individual, and that program, has to be changed and tailored to you. And if it doesn't work, like, let's make a change. Let's talk about it. Let's have the time for an hour or an hour and a half to sit down and talk about what's going on and what we can do to help move you towards health and be successful. And that's something that happens with time.
Yeah. Mm-hmm.